Neurostimulation is bringing us effective means of dealing with primary headache disorders that we haven't been able to deal with easily using conventional treatments. And indeed, many patients don't want conventional treatments. They're asking us for what can we do instead of a tablet? So there are two mechanisms that I talked about, or two approaches that I talked about here at the meeting. So I talked about the use of transcranial magnetic stimulation, a device that delivers a pulse of a TMS pulse, a magnetic pulse, rather like an MRI imaging device that can be applied, typically applied to the occipital cortex, and is useful in migraine, particularly migraine with aura, and useful as a migraine preventive. The other device that I talked about that's quite useful is non-invasive vagal nerve stimulation that takes advantage of the fact that the vagus nerve projects into the trigeminal system and has evidence both in migraine, in the acute treatment of migraine, and really excellent evidence, two randomised sham-controlled trials in the treatment of acute attacks of cluster headache in patients with episodic cluster headache. When using neuromodulation, it's important, if you're going to get the right patient, it's important to start by asking the patients about their experience with treatments and what they're expecting. So at some level, these approaches are right for people who are looking for a non-drug approach. Now, if I was to be a bit more granular about who one would expect to have a response in, there's very good data for transcranial magnetic stimulation in acute treatment, and I think very good data in preventive treatment. So I tend to use it for patients where they've had a bad experience with preventives, are not interested in taking a preventive. I mean, typically in migraine, the migraineur is a female. They're very often in their reproducing years, and offering them a preventive or acute attack treatment that has no detrimental effect in pregnancy really gets their attention. So much of neuromodulation is trying to understand the patient's position and their experience and what they expect to try and select treatments. When you look at non-invasive vagal nerve stimulation, for example, there's very good physiological data to suggest it interacts with the cranial autonomic outflow pathways. So in people with migraine, you'll ask them about those sorts of symptoms like lacrimation, conjunctival injection, nasal congestion, and perhaps that's a group to think about. And of course, in cluster headache, where the evidence, where there's a clear evidence and licensing, I tend to tell them about the device in cluster headache, because in cluster headache, a big problem is if they're having 3, 4 more attacks a day, they're limited to 2 injections of sumatriptan. Oxygen is very effective, but it's a little bit inconvenient to carry the canister around to work. And the vagal device, they can use it a number of times a day, and it's very easy to take to work. So I think the fundamental message is to take a broad view and to understand how the treatments can fit into the patient. I think it's important that you start with the patient, understand what their issues are, and then bring the resources we have to their problem.